We move on now to Dr. Fazil. Dr. Fazil wears many hats and holds appointments at the Singapore Sport and Exercise Medicine Center at Changi General Hospital, the Singapore Sports Institute, the Orthopedic Sports and Joint Center in Singapore General Hospital. He is also involved in SingHealth Duke NUS Sport and Exercise Medicine Center, as well as Exercise is Medicine Singapore, the latter of which is a part of a global initiative that promotes physical activity and exercise in the prevention and management of chronic medical conditions. He contributes his expertise to community work as well, especially in M3 and Alliance of the three key Malay Muslim organizations. And you've heard about COVID-19, you've heard about how to live with diabetes. I think what is also on your mind is how do you in this circuit breaker period keep healthy and exercise during COVID-19? And Dr. Fazil will enlighten us.
Hi. Hello, everyone. Hi, I'm Fazil. Thank you to Kevin, thank you to Diabetes Singapore, and thank you to Roche for inviting me for this to be a speaker in this webinar. So I think we've heard from the previous two speakers on how COVID-19 has impacted our lives. And definitely with all the social distancing measures, with the decrease in social interaction, it has also definitely affected how we have been engaged in our physical activity. Now, even though it is a difficult period for everyone, it doesn't mean that we should stop whatever we are doing and become inactive. We need to keep ourselves active, as we know physical activity and exercise are very important in terms of managing our chronic medical conditions, especially diabetes, relevant to our topic today. So I'm just going to speak to you about how physical activity or exercise is important in terms of managing diabetes. Now, we know that physical activity and exercise, it helps in terms of managing diabetes in the short term as well as in the long term. Some of the acute effects of physical activity involves or includes improving your insulin sensitivity. And we all know that in diabetes, it all revolves around the insulin pathway. And with improvement in terms of how our body reacts or responds to insulin, it helps in terms of managing our glucose control and our glucose levels in our body. And long-term wise, if we are able to control or if we are able to manage your glucose over a long term, it definitely prevents you from getting complications which are associated with diabetes, namely heart disease and strokes, as well as eye complications and vascular complications. On top of that, we know that diabetes itself is related to many other chronic medical problems, things like diabetes, things like high blood pressure, things like obesity, things like high blood pressure and heart disease. And we know that as we are getting ourselves more active, as we engage in regular exercise, this will help to prevent us or even manage these chronic medical conditions. And we have heard Dr. Jyoti saying that these are also risk factors for COVID's complications. So if we are able to manage these chronic medical conditions, we are definitely able to get ourselves away from all these complications. Regular exercise, especially moderate intensity exercise, helps to improve our immunity and therefore reduces our risk of getting acute infections like COVID. On top of that, generally exercise helps to improve our aerobic fitness, especially our cardiorespiratory capacity. So with improved ventilatory capacity, we definitely have better and healthier lungs. And this will help to reduce and mitigate any respiratory complications that can come about with acute respiratory infections. Apart from that, it helps to improve our muscular strength and endurance. And especially for elderly, it helps to prevent deconditioning, especially with prolonged rest and inactivity. With that, with exercise, it helps to improve your functional independence and therefore reduces the risk of falls. It reduces our fatigue and our lethargy and therefore helps us increase our productivity in school or at work. Finally, it also helps in terms of improving our cognitive function. With this, it also helps in terms of allowing us to make better choices, make better decisions, and make better plans, especially with choosing food. It helps to manage our stress, especially during this challenging period. So now that we have talked about what are the benefits of physical activity and exercise, it is important for us to now find out what is considered good enough exercise. Now, we divide exercise into lifestyle activities as well as recreational activities. And for recreational activities, that's where it's divided into aerobic, strength, and balance activities. We are all very familiar with lifestyle activities. Lifestyle activities are those that you do in your daily life. And how we measure it is in terms of the number of steps that we take each day. And what's being recommended in our National Physical Activity Guidelines is for us to have at least 10,000 steps a day. And this is equivalent to walking 8 kilometers. Now, it doesn't mean that you have to walk 8 kilometers in one shot. You can do it in bouts, and this is cumulative for 10,000 steps a day. For aerobic activities, these are activities which help in terms of improving your cardiovascular fitness. Basically, these are physical activities that make your heart beat faster, that make you breathe faster. And what's being recommended is for you to engage in a cumulative of 150 minutes of moderate intensity aerobic activities in a week, or an equivalent of 75 minutes of high intensity physical activities a week. We're going to talk about what it all means in a short while later. Now, although aerobic activities is the main hallmark of physical activity which is being recommended, it is important for us to have our activities supplemented by strength training activities. Basically, these are resistance exercises that work the major muscle groups. What's being recommended is for you to engage at least 2 days or more a week of strength training activities, and they should include exercises which involves the major muscle groups of your upper limbs, your core muscles, as well as your lower limbs. And this should be in the form of 3 to 4 sets of 10 to 12 repetitions of exercises. And finally, for elderly people, because of their increased risk of falls, it is important for them to engage themselves in regular balance activities as much as possible. Now, we have talked about moderate intensity, high intensity. Now, the next question is, how intense or how difficult should my exercise be? Now, it is very difficult. It is very easy in how you can quantify the difficulty of your exercise. And this is simply using your talk test, okay? So in talk test, we divide the exercises into low, moderate, or vigorous intensity. For low intensity activities, basically when you are engaged in any of these activities, you should be able to continue with your conversation. You can talk, and you can even sing while you are doing these activities. An example would be strolling along the beach, for example. Moderate intensity exercises are those whereby if you are to be doing them, you can talk. Your conversation is basically just restricted to short sentences, and you should not be able to sing. And that's because you are basically breathing a little bit harder and a little bit faster. Examples of such activities include brisk walking or even jogging. Now, high or vigorous intensity activities are those activities whereby you are feeling really tired, you'll be panting, and you are not able to talk or even sing while you are doing these activities. So what is being recommended is for you to engage yourselves in moderate intensity activities using the talk test. So the next question that a lot of people will be asking, now that I have diabetes, is exercise considered safe? Well, generally, light intensity exercises are safe, but if you are to be engaged in unaccustomed, moderate or high intensity activities, especially if you're not used to exercising at all, and if you are doing it at high volumes, now this is not advisable. So therefore, it is important for you to consult your physician, your healthcare team who's seeing you for your diabetic condition before you embark on an exercise program. If you are unsure of your own health status, if you have never exercised, or if you have other chronic medical conditions, like for example, if you have diabetic complications, if you have heart disease or high blood pressure. If you are pregnant, it is important for you to also consult your physician before you embark on an exercise program. And now that we're in the fasting month, it is also important for you to see your doctor and to ask and have further guidance from doctor on how you can customize your exercise program during this period. And of course, if you're feeling unwell, please do not exercise. So now that you have spoken to the doctor, or if you are to be engaged in some form of exercise at this moment, where and how should you start? Now, it is important for you to have a realistic plan so that you are at least exercising in a safe manner. Now, if you have never been exercising ever before, it is important for you to start at low intensity exercises and to go slowly within your comfort zone. You can do so by increasing your lifestyle physical activities. Just stay active as much as possible. Try to break as much physical inactive times. Break sedentary times as much as possible. For example, if you are working from home or if you are watching your favorite movie on TV, stand up and walk around during the commercials. Take breaks in between your work, while you're working on the laptop or your desktop. Take breaks every 30 minutes to walk around, to do some simple exercises. If you are on the phone at home, you can afford to walk around while chatting on your phone. Now, to make things even simpler, to make exercise as something that is common or natural to you, what you can do is to incorporate more physical activities in your daily essential routines. For example, if you are walking, if you are going to the market, it is important for you to walk instead of drive. Now that we have been advised to avoid crowds, maybe it's time for you to walk a slightly longer distance to avoid crowded areas. Take the stairs instead of taking the lift. Do your house chores more regularly, especially trying to keep your living environment clean to prevent yourself from getting unnecessary infections. And for those of you who are celebrating Hari Raya in 3 weeks' time, it is important for you to keep your house clean. So to prepare yourself for Hari Raya early, so do your house chores more frequently and more regularly. If you have a pet, for example, some of you have a dog at home, you can bring your dog out for a walk. Now, how do I progress? If let's say I've been doing all these lifestyle activities, what if I want to embark myself on a specific exercise routine? How should I start? Now, for aerobic activities, if you have never done any form of aerobic activities apart from your lifestyle activities, it is important for you to start low, go slow, by just starting off with light intensity activities. Remember, light intensity activities are safe. And if you want to include them, you can just start off with just walking at home. And if you need to go outdoor for these activities, you can just go for a short walk in your immediate neighborhood. If, let's say, you have been active, if you have been exercising all this while despite being diabetic, if you have had clearance by your doctors, it is important for you to continue with your current moderate intensity exercises. For strength and balance activities, you can start doing them within the comforts of your home. Start low, and of course, go slowly. Now that we are in the circuit breaker period, a lot of us will be having this question in our mind: which is safer, to exercise indoors or to exercise outdoors? Now, again, this is based on your own preference, but of course, now that we are in a circuit breaker period, it is most advisable for you to have your activities indoors. Stay at home, especially if you are above 60 years old, or if you have chronic medical problems like diabetes or any other chronic medical problems which I have mentioned. Now, remember, even when you are exercising at home, please do not invite any of your friends or family members who reside outside your household to join you. And of course, you are not at all allowed to have any personal trainers or coaches conducting these exercises at home with you. But of course, it is always fine for you to do so via telecommunication. Now, if you really have to exercise outdoors, remember to do so alone. Please wear a mask if you're not doing any strenuous exercises. And please exercise in open, uncrowded areas in your immediate neighborhood for good ventilation. Always practice safe distancing. And of course, make sure you bring yourself a towel bring your own water bottle. Avoid using the water fountain when you are exercising outdoors. Bring your own water bottle for your own hydration. Use your own towel to wipe your sweat, and of course, to wipe any form of dirt. And remember, no handshakes, no high fives. If you see any of your friends in the park or in your immediate neighborhood, avoid unnecessary body contact with anyone or any objects. And of course, always practice hand and personal hygiene. Always wash your hands the moment you come back home. Do not touch your face. And of course, go for a bath immediately. Change to a new set of clothes once you're back home. So what if I want to exercise at home? What can I do? Esther has said that, exercising at home has its perks because you are away from the judgment of people around you. You can do it within the comforts of your home. You can do it at any time of the day. So at home, I've listed down some of these links of which you can actually get free online resources to have videos. Some of them even have like a daily program that you can actually follow. And some of them even include exercises that you can do using home appliances or home equipment. Things like, for example, using water bottles or using towels that you can find at home. So it doesn't mean that if you are not able to access the gyms, you cannot do any of these exercises. You can, because a lot of times you can actually do exercises using your own home equipment and home appliances. If you are doing outdoors exercises, you can go on with your walking, your brisk walking, cycling, or even staircase climbing if you are living in an apartment. You can even use your skipping rope and skip in your void deck. You can do some calisthenic exercises or even do workouts or Tai Chi alone in your void deck outdoors. So what do I need to think about if I am exercising, if I have diabetes? Remember, you need to exercise some precautions. Now, when I say precautions, these are precautions with regard to diabetes alone, but also bear in mind that being a diabetic, you are also taking medications. So the medications do itself pose some effects that you need to think about, because a lot of times these medications will tend to actually cause hypoglycemic episodes. So it is important for you to actually exercise these precautions if you are exercising when you have diabetes. Now, before exercise, it is important for you to actually monitor or find out what is your current blood glucose level at least 15 to 30 minutes before your exercise. And this is especially so if you have been on medications, or if you have never had any previous regular exercise before, or if you are exercising during special circumstances, like for example, during Ramadan. If you have a blood sugar of less than 5.6, this means that your blood sugar may be a little bit too low. If you are not fasting, it is important for you to have some form of carbohydrate snacks, like banana or fruit juice, just to make sure to boost up your fuel levels a little bit before you actually start exercising. If you are fasting with a blood sugar level of less than 5.6, please do not do any form of exercises. You might want to actually monitor your blood glucose very closely. And of course, depending on your threshold, you might want to actually consider not fasting the following days if your blood sugar is continuously low. The best and ideal blood sugar level to resume exercises will be between 5.6 to 13.9. Anything that's above 13.9, especially if it's higher than 16.6, it is important for you not to exercise. If you do have any urine dipsticks at home, it is also important for you to note whether you have any ketones in your urine, especially with the blood sugar level of more than 16.6. If you do have, the chances of you developing diabetic ketoacidosis are much higher, and therefore please do not exercise and please keep yourself hydrated. Now, if let's say you are having a blood sugar level that allows you to exercise and you are embarking, you're starting your exercise, please do adequate warm-ups. Warm-ups are simple, low-intensity exercises which mimic the exercises that you're going to do as part of your exercise routines. Please make sure that you spend at least about 10 to 15 minutes doing warm-ups. Warm-ups are important because they help to improve or increase your heart rate. And therefore, with this, it prepares you physiologically for your exercise that you're going to do. Now, diabetics are at risk of developing a lot of food complications or food diabetic conditions like ulcers. So please look at your feet before you exercise. If you do have any open wounds, please make sure you dress and you cover these open wounds. Wear shoes of good fit. Even if you are exercising at home, please get yourself, please consider wearing shoes because this will help to support your feet. If you do have any form of foot conditions, you might want to consider having or wearing your insoles if necessary. Wear appropriate clothes for your exercise, especially if you are exercising outdoors. Now, if you do have any form of what do you call a diabetic identification, diabetes identification, such as bracelets or necklace, please bring them with you. Please bring your handphone with you if you're exercising. You know, previously we advise diabetics to exercise with their friends when they're exercising outdoors. Now that you are not able to do so, it is always important for you to keep to inform someone that you are going to be exercising outdoors alone, and of course to bring yourself your handphone so that at least in the event of emergencies, it is able for you to contact any of your family members or your friends or even medical help. Drink water adequately to prevent yourself during exercise, and of course to carry with yourself some form of sugar, such as sweets or glucose tablets with you when you exercise. Now, stop exercising if you feel unwell. For example, if you feel weak, I am assuming that many of you have been taught on how to recognize the signs and symptoms of hypoglycemia. So if you do feel or if you experience any of these symptoms, please stop exercising and seek immediate medical help. Now, what happens after you exercise, especially if you're not feeling well? It is important for you to check your blood sugar levels. And of course, to note that if you do have hypoglycemia, remember your blood sugar levels may continue to fall for the next 4 to 8 hours after exercise. So therefore, it is important for you to eat some form of a carbohydrate snack, like a banana after you exercise to prevent further dips in your blood sugar levels. Rehydrate yourself because, you know, if you have been exercising, you are definitely at risk of developing dehydration, especially with the excessive sweat loss. Do not rest immediately after your exercise, but spend another 10 to 15 minutes doing a cool down to allow your body to return to its physiological norms. Always check your feet as you remove your footwear because sometimes you may end up getting blisters, and if you don't address them or if you don't put any form of dressing to them, they can get infected. Now, what if you have diabetic complications? So one of the common complications that you have heard of will be your diabetic retinopathy, which basically affects the film at the back of your eye. What's being recommended is if you have been told to have a diabetic eye complication, it is important or it is recommended for you to engage yourself in exercises which are of low impact, such as swimming, walking, or even using the stationary bikes or doing Tai Chi. Try to exercise in well-lit or brightly lit environments. So therefore, it is important for you to exercise in the day rather than exercising at night. Avoid contact sports as this will affect or this will increase your risk of developing retinal complications like a retinal tear. Do not do any strenuous activities which involve a lot of pounding or jarring movements, or movements that involve sudden postural changes or whiplash movements, such as your burpees or your headstands or your sit-ups. And if you are doing any form of resistance or strength training exercises, try to avoid any breath holding or Valsalva maneuvers, as this will increase your intracranial or pressures within your eye. For those of you who have had diabetic foot conditions, it is important for you to dress and cover all wounds, wear shoes which are appropriate fit, avoid any high impact activities and do more low impact ones like walking or using the stationary bikes. And if you do have open wounds, please do not exercise bare feet, especially in soiled environments. Do not do any form of water-based activities or contact sports. Some of you have been told to have peripheral neuropathy or autonomic neuropathy. These are basic complications which affect your nerves. And people with peripheral neuropathy often have sensory disturbances in the gloves or stockings distributions. So the tendency is they tend to have a lot of numbness or even tingling sensations in their hands, their palms, or even in their feet. If you have autonomic neuropathy, they tend to actually affect your blood pressure. You tend to have a lot of postural giddiness, and you may end up having you have a higher risk of falling. So therefore, if you have any of peripheral neuropathy or autonomic neuropathy, the recommendations is for you to exercise in safe environments. Safe environments will include environments which are away from any hazards, environments which are away from any form of obstacles, and you do not have any sharp objects on your floor. Put on a pair of shoes if you are exercising at home as well, just to protect your feet. Non-weight bearing exercises are definitely safer in such situations. So things like swimming, seated exercises, or doing arm cranking exercises are definitely much more safer compared to anything that involves your lower limbs. Avoid any exercises which involves sudden postural changes like your burpees or your sit-ups. And again, do not do any Valsalva maneuvers or breath-holding maneuvers when you are doing weights or resistance exercises. So this is my last slide. What have I learned today? So in conclusion, remember, physical activity can be safe for everyone, and it's definitely recommended even during times like these. It is all about having a realistic plan. So choose the types of your physical activity or exercise that is appropriate to your fitness, as well as knowing what your health goals, as some activities are definitely safer than others. Start low, go slow. So always increase your physical activity gradually over time. Have a goal in mind, and of course, do so over time to meet the guidelines that has been recommended. Always choose your environments to exercise safely. Always follow your rules and policies, especially during this circuit breaker period. And of course, to protect yourself and protect others during this circuit breaker period and during this pandemic, use appropriate gear and sports, and of course, to be socially responsible. Always consult your healthcare providers if in doubt. Many of your doctors, in fact, are now trained to prescribe exercise. So ask and speak to your doctor, speak to your diabetic healthcare team. If you have any doubts, what are the best ways and what is the best exercise prescription for you? All right.
Thank you, Dr. Fazil. I'm sorry that we've taken a little bit more time than we had planned to, but as you can see, there is so much information that we wanted to convey across, and I'm sure that you found this very helpful. I want to thank the speakers that they have built in the answers to a lot of questions over the last few days into their presentations, and so we have actually answered a majority of questions. We'll probably close in about 5 minutes. I just want to bring out some last minute questions that we may have and direct it to our presenters. There have been a few questions on what blood sugar targets a person with diabetes should aim for during this period, and about the impact of fruits on blood sugar, because there are people who are trying to eat more healthily and having more fresh fruits, but finding that the blood sugar is high in the fruits. Maybe Dr. Esther, you could share with us your thoughts on this.
Okay, so I think I will address the question on fruits first. Now, fruits actually contain carbohydrates. So once they enter the body, they are also broken down into sugars. And as such, having just the right quantity of fruits actually is important. And that's why if you remember in my earlier slide, I hinted that more vegetables as compared to fruit. For fruits, perhaps keep it to your 2 portions of fruits. 2 portions of fruits means, for instance, 1 medium-sized apple or a wedge of papaya, and this would be considered 2 portions, which would fulfill the day's requirements. Yeah, so that's the answer for the fruits. I think for blood glucose targets, it seems like quite a simple question, but actually can become very, very complex. And blood glucose targets really need to be individualized with your doctor, because this depends on your type of diabetes, your duration of your diabetes, whether you have other complications of diabetes like kidney problems or heart disease, or whether you've had been exposed to multiple episodes of low blood sugar or hypoglycemia episodes in the past. So actually, blood glucose targets really need to be individualized with your doctor. It also depends on which part of the journey of your diabetes journey you are at, whether it's at the initial stage of the diagnosis or whether you've already lived with diabetes for 10 to 20 years. Yeah, so for this, I think I would have to say that you should go back to your doctor and ask specifically, you know, what are your before meal blood glucose targets or your 2-hour post meal blood glucose targets in order to achieve your target HbA1c. So your HbA1c is your average blood glucose over 2 to 3 months period. Yeah.
Thank you. Maybe I can throw this question to both Dr. Fadzil as well as Dr. Esther about after exercising, if the blood sugar shoots out after exercise, how do you manage this?
Yeah, perhaps I can go first. Depending on the type of exercise you're taking part in, I think Dr. Fadzil did allude to this earlier. If it is, let's say, fast sprint, or he mentioned burpees and all that. Now, these are what we would call perhaps exercises which would activate your stress hormones. And so this will also spike the blood glucose immediately after exercise. But over time, actually, the body will also become more sensitive to the insulin that is being produced in your body, or if you're on insulin injections, and the blood glucose levels will actually stabilize later on. Yeah. Dr. Fadzil, I'm not sure if you have anything else to add on this.
Actually, no. The thing is, the rise in your blood sugar is not going to be very significant up to the point of getting you into a hyperglycemic state. But rather, I think it is a normal physiological response for the body to actually mobilize your fuel stores from the liver with the increased demands of exercise. Because you see, when you exercise, you need energy. And with that demand, your liver will start to mobilize this glucose. The glucose goes into your bloodstream, but it doesn't stay there. Why? Because as what Esther has said, exercise is also shown to improve the absorption of the glucose into the cells where it can be used as fuel for the exercise. So basically, the exercise itself will help to stabilize the slight increase in your blood sugar level.
I think just one more question, if I can pose to Dr. Esther, is about the use of insulin in diabetes during COVID-19. The query is whether there are any issues with using insulin. People with diabetes on insulin more at risk for COVID-19 complications?
Okay, so I think this really depends on your pre-existing diabetes control, how well it's controlled over a long period of time. So the glycemic control over a period of time, if it has been relatively well controlled, whether it's on insulin analogs or on human insulin, then there is no difference. Although, as I mentioned also that diabetes itself can increase the severity of COVID-19 infection, but the type of treatment of the insulin, I think that was the question, does not impact on the severity of the COVID-19 infection.
Thank you. So I think we've had a very productive 1.5 hours. So if you have heard the truths on COVID-19 from Dr. Somani, the differences between COVID-19 and the common flu and influenza, which I think is very important, and why all of us need to take the precautions that have been imposed on us. You've heard from Dr. Esther that you shouldn't neglect your diabetes management during COVID-19, and she gave practical points on how you can manage your diabetes well during COVID-19. And may I challenge all of you who are living with diabetes during this pandemic to try to be even more healthy uh, uh, during this period of the pandemic. And finally, Dr. Fazil gave practical and safe tips for persons with diabetes on how to both initiate as well as to intensify exercise during this period. And he gave some links for you to refer to for exercise videos and tips. And we will also circulate that. And so, um, just humor me by allowing me to show this. That this is a fundraising initiative by Diabetes Singapore. Um, and it may be a good opportunity for you to participate. This is actually a virtual walk. You can walk within the confines even of your house or flat or room. And if you want to know more information, go to the website address there. And so with that, I want to thank all of you for dialing in and for listening to this webcast. I want to thank all our eminent speakers who have shared with us their thoughts and their expertise on how to deal with diabetes during COVID-19. Dr. Jyoti Somani, Dr. Esther Yeo, and Dr. Fadzil Hamza. And it just leaves me to finish with what I started off by wishing all of you and your loved ones health and safety in these unprecedented times. And to the Muslims who are listening in, Selamat Berpuasa. Thank you very much.